Hello, everyone, and welcome to our comprehensive guide on heart health in later years. As we gracefully age, our bodies undergo many changes, and our heart, the tireless engine of our lives, is no exception. It's natural to have questions and concerns about heart health as we get older, and perhaps even feel a bit apprehensive about common heart conditions that seem to affect many seniors. But here's an important truth. While age is a risk factor, heart disease is not an inevitable part of aging. With the right knowledge and proactive steps, we can significantly reduce risks, manage conditions effectively, and lead vibrant, fulfilling lives well into our golden years. Our goal today is to demystify common heart diseases in older adults, explore their causes, understand their symptoms, and most importantly, equip you with practical strategies for prevention and management. We'll delve into lifestyle changes, medical solutions, and the crucial role of early detection. This video is designed to be a comprehensive resource, empowering you to take control of your heart health journey. So let's embark on this journey together, armed with information and a positive outlook to ensure your heart continues to beat strongly for many more years to come. Now, let's talk about some of the most common heart diseases that tend to affect us as we get older. Understanding these conditions is the first step towards managing and preventing them effectively. Firstly, we have coronary artery disease, or CAD, which is often linked to atherosclerosis. Imagine your arteries as smooth, clear pipes. Over time, due to various factors like high cholesterol, high blood pressure, and inflammation, fatty deposits called plaque can build up inside these pipes. This buildup, atherosclerosis, narrows the arteries, making them stiffer and restricting blood flow to the heart. When the heart muscle doesn't get enough oxygen-rich blood, it can cause chest pain, known as angina. If a plaque ruptures, a blood clot can form, completely blocking the artery, leading to a heart attack. This condition becomes more prevalent with age because the plaque buildup is a gradual process that accumulates over decades. Next, let's discuss heart failure. The name can be misleading. It doesn't mean your heart stops working, but rather that it isn't pumping blood as efficiently as it should. Your heart can become too weak to pump enough blood to meet your body's needs, systolic heart failure, or too stiff to fill properly with blood, diastolic heart failure. This leads to symptoms like shortness of breath, fatigue, and swelling in the legs and ankles as fluid builds up. In older adults, heart failure is often the result of years of untreated high blood pressure, previous heart attacks, or other chronic conditions that weaken the heart muscle. Moving on, we encounter arrhythmias, which are irregular heartbeats. Your heart has an electrical system that keeps it beating rhythmically. When there's a problem with this system, your heart might beat too fast, too slow, or irregularly. One of the most common arrhythmias in older adults is atrial fibrillation, or AFib. In AFib, the upper chambers of the heart beat chaotically and irregularly, leading to an increased risk of stroke because blood can pool and clot in the heart. Other arrhythmias can cause palpitations, dizziness, or fainting. The likelihood of developing an arrhythmia increases with age due to structural changes in the heart's electrical pathways and conditions like high blood pressure or other heart diseases. Then there's valvular heart disease. Your heart has 4 valves that act like one-way doors, ensuring blood flows in the correct direction. With age, these valves can become stiff and narrow, stenosis, or fail to close properly, causing blood to leak backward, regurgitation. Aortic stenosis, where the aortic valve narrows, is particularly common in older adults and can cause chest pain, fainting, and shortness of breath. These changes often occur due to calcification, a buildup of calcium deposits on the valves over many years, a process accelerated by aging. Finally, we must talk about hypertension, or high blood pressure. Often called the silent killer, hypertension frequently has no obvious symptoms, but it's incredibly damaging to your heart and blood vessels over time. When your blood pressure is consistently too high, your heart has to work much harder to pump blood. This extra strain can thicken the heart muscle, making it less efficient, and also damages the walls of your arteries, contributing to atherosclerosis. Hypertension is a major risk factor for all the other heart conditions we've discussed, and becomes more common with age as arteries naturally stiffen. Understanding these specific conditions helps us appreciate why proactive steps are so crucial. Now that we understand the common conditions, let's explore their roots, the causes and risk factors that contribute to heart disease, especially as we age. It's a combination of factors, some we can't change, and many we absolutely can. First, let's acknowledge age itself. As we get older, our blood vessels naturally become less elastic and stiffer, a process called arterial stiffening. The heart muscle itself can also thicken slightly, and the electrical system might experience some wear and tear. These are natural physiological changes, but they create a fertile ground for heart problems if not managed. Next, genetics and family history play a significant role. If your parents or close relatives developed heart disease at an early age, you might have a genetic predisposition. This doesn't mean you're destined to get it, but it highlights the importance of being extra vigilant with your lifestyle and screenings. Knowing your family history empowers you to take more aggressive preventive measures. Beyond what's inherent, lifestyle choices are incredibly powerful. Poor diet is a major culprit. Diets high in saturated and trans fats, cholesterol, sodium, and added sugars contribute directly to high cholesterol levels, high blood pressure, and inflammation, all precursors to heart disease. Think of fast food, processed snacks, and sugary drinks as direct adversaries to your heart. Conversely, a diet rich in fruits, vegetables, whole grains, and lean proteins can protect your heart. Lack of physical activity is another significant risk factor. A sedentary lifestyle contributes to obesity, high blood pressure, high cholesterol, and diabetes. Our bodies are designed to move, and when we don't, our cardiovascular system suffers. Even moderate activity can make a profound difference. Smoking, perhaps one of the most detrimental habits, dramatically increases your risk. The chemicals in cigarette smoke damage blood vessels, promote plaque buildup, and make your blood more prone to clotting. It's a direct assault on your heart and arteries. Similarly, excessive alcohol consumption can raise blood pressure, contribute to arrhythmias, and weaken the heart muscle over time. Moderation is key. Furthermore, several coexisting medical conditions are closely linked to heart disease. Diabetes, especially if poorly controlled, is incredibly damaging to blood vessels throughout the body, accelerating atherosclerosis. High blood sugar levels create inflammation and damage that pave the way for heart attacks and strokes. High cholesterol, particularly elevated LDL, bad cholesterol, and low HDL, good cholesterol, directly fuels plaque formation in arteries. Obesity, especially abdominal obesity, puts tremendous strain on your heart, requiring it to work harder. It's also strongly associated with high blood pressure, diabetes, and high cholesterol, creating a cascade of risk factors. Finally, chronic stress is an often underestimated factor. Prolonged periods of stress can lead to elevated blood pressure, increased heart rate, and release of stress hormones that can harm your heart over time. It can also lead to unhealthy coping mechanisms like overeating or smoking. Understanding these causes allows us to see where we can intervene most effectively to protect our heart. Understanding the causes is vital, but equally important is recognizing the signs and symptoms of heart disease and knowing when to seek help. This can be particularly challenging in older adults, as symptoms can sometimes be subtle or atypical. Let's start with common symptoms that many people associate with heart problems. Chest pain or discomfort, often described as a pressure, squeezing, fullness, or aching in the center of the chest, is classic angina. Shortness of breath, especially during activity or when lying down, can be a sign of heart failure. Persistent fatigue, feeling unusually tired, even after rest, is another common but often overlooked symptom. Swelling in the legs, ankles, or feet, known as edema, occurs when the heart isn't pumping effectively, leading to fluid buildup. Dizziness or lightheadedness and palpitations, a feeling of a skipped, fluttering, or racing heartbeat, are also important indicators. However, In older adults, these symptoms can be atypical. This is crucial to understand. Due to changes in nerve function and overall body responses with age, seniors might experience different or less severe symptoms than younger individuals. For example, instead of classic chest pain, an older person might feel discomfort in their arm, shoulder, back, neck, jaw, or stomach. They might experience general weakness, unexplained nausea or indigestion, or even just increased confusion or a sudden change in mental status. Sometimes, the only symptom might be a sudden increase in falls or a generalized feeling of not feeling well. The danger here is that these atypical symptoms are often dismissed as just getting old or attributed to other conditions, delaying crucial diagnosis and treatment. This highlights the importance of not dismissing symptoms. Never assume a new or worsening symptom is simply a normal part of aging. Your body communicates with you, and any persistent or new symptom, no matter how mild, warrants a conversation with your doctor. Early detection is paramount. Knowing when to seek immediate medical attention is critical. If you experience sudden, severe chest pain that radiates to your arm or jaw, severe shortness of breath, sudden weakness, fainting, or prolonged unexplained dizziness, do not hesitate. Call emergency services immediately. These could be signs of a heart attack or another life-threatening emergency. Don't try to drive yourself to the hospital, and don't wait for symptoms to get better. Time is muscle when it comes to heart health, and prompt treatment can save lives and minimize damage. Remember, your doctor is your partner in health. Regular checkups allow for early detection of risk factors and subtle changes that might otherwise go unnoticed. Listen to your body, communicate openly with your healthcare provider, and always err on the side of caution. Armed with knowledge about common conditions and their symptoms, let's now turn our attention to the incredibly powerful tools we have at our disposal: home and lifestyle solutions. These are the daily choices that can significantly impact your heart health and often serve as the first line of defense or a crucial complement to medical treatments. Let's dive into dietary changes. What you eat profoundly affects your heart. Aim for a DASH, dietary approaches to stop hypertension, or Mediterranean diet approach. This means focusing on a rich variety of fruits, vegetables, and whole grains. Incorporate lean proteins like fish, poultry, beans, and legumes. Opt for healthy fats found in olive oil, avocados, and nuts, which contain monounsaturated and polyunsaturated fats beneficial for cholesterol. Crucially, practice sodium reduction. High sodium intake directly contributes to high blood pressure. Read food labels carefully. Choose low-sodium options and season your food with herbs and spices instead of excessive salt. Also, focus on sugar reduction. Added sugars, common in processed foods and drinks, contribute to weight gain, inflammation, and increase the risk of diabetes, all detrimental to heart health. Portion control and adequate hydration are also key. Drink plenty of water throughout the day. Next, physical activity is non-negotiable for heart health. Even as you age, the key is to find activities tailored to your abilities and always consult your doctor before starting any new exercise regimen. Aim for at least 150 minutes of moderate intensity aerobic activity per week, like brisk walking, swimming, dancing, or cycling. Break it into shorter, manageable chunks if needed. Incorporate strength training with light weights or resistance bands 2 to 3 times a week to build muscle, which supports metabolism. Don't forget flexibility exercises like stretching or yoga to improve range of motion, and balance exercises like Tai Chi to prevent falls, which can indirectly impact overall health. Making exercise enjoyable, perhaps by exercising with a friend or joining a group, can make it a sustainable habit. Stress management is another vital pillar. Chronic stress elevates blood pressure, increases heart rate, and contributes to unhealthy coping mechanisms. Incorporate relaxation techniques into your daily routine. Practice mindfulness meditation, deep breathing exercises, or gentle yoga. Engage in hobbies you love, spend time in nature, and maintain strong social connections. If stress feels overwhelming, consider seeking support from a therapist or counselor. Smoking cessation and alcohol moderation are critical. If you smoke, Quitting is the single most impactful step you can take for your heart health. Seek support from your doctor, support groups, or nicotine replacement therapies. For alcohol, moderation is key. Up to 1 drink per day for women and up to 2 drinks per day for men. Excessive alcohol intake can raise blood pressure and contribute to heart muscle damage. Weight management is also crucial. Maintaining a healthy weight reduces the strain on your heart and lowers your risk for high blood pressure, diabetes, and high cholesterol. Focus on gradual, sustainable changes to your diet and activity rather than drastic measures. Consult with a healthcare professional to determine a healthy weight range for you. Finally, regular health monitoring at home and with your doctor is essential. Keep track of your blood pressure, blood sugar, and cholesterol levels. This proactive approach allows you and your healthcare provider to catch any issues early and adjust your lifestyle or treatment plan as needed. These home and lifestyle solutions are powerful, accessible, and form the foundation of a heart-healthy life. While lifestyle changes form a strong foundation, for many older adults, medical solutions become an essential part of managing heart disease effectively. It's crucial to understand that these aren't just fixes, but ongoing management strategies developed in partnership with your healthcare team. Let's explore the range of medications commonly prescribed. Firstly, statins are often used to lower cholesterol levels, particularly LDL, your bad cholesterol, thus reducing the risk of atherosclerosis. ACE inhibitors and ARBs, angiotensin receptor blockers, are vital for managing high blood pressure and can also be crucial in treating heart failure by relaxing blood vessels and reducing the heart's workload. Beta blockers help slow your heart rate and reduce blood pressure, commonly used for high blood pressure, angina, and certain arrhythmias. They can also improve outcomes in heart failure. For fluid retention often seen in heart failure, diuretics or water pills help the body get rid of excess fluid, reducing swelling and shortness of breath. To prevent dangerous blood clots, especially in conditions like atrial fibrillation or after a heart attack, antiplatelets like aspirin and anticoagulants, blood thinners such as warfarin or novel oral anticoagulants, NOACs, are prescribed. These medications reduce the risk of stroke and further heart events. For angina, nitrates help relax blood vessels and increase blood flow to the heart. The importance of adherence to medication cannot be overstated. Taking your medications exactly as prescribed, without skipping doses or stopping them prematurely, is vital for their effectiveness. If you experience side effects, discuss them with your doctor. Never adjust your dosage without medical advice. Given that many older adults take multiple medications, polypharmacy, the use of many different drugs, is a concern. Always keep an updated list of all your medications, including over-the-counter drugs and supplements, and review it regularly with your doctor or pharmacist to avoid potential drug interactions. Beyond medications, there are various medical procedures that can significantly improve heart function and quality of life. For blocked arteries, angioplasty and stenting are common. During angioplasty, a balloon is used to open a narrowed artery, and a stent, a small mesh tube, is often placed to keep it open. For more severe blockages, coronary artery bypass grafting, CABG, or bypass surgery might be necessary, where a healthy blood vessel is taken from another part of the body to create a new path around a blocked artery. For arrhythmias, pacemakers and implantable cardioverter defibrillators, ICDs, are devices implanted to regulate heart rhythm or deliver an electrical shock to correct dangerous arrhythmias. Cardiac ablation is another procedure where abnormal heart tissue causing arrhythmias is destroyed. For valvular heart disease, valve repair or replacement procedures, either surgically or minimally invasively, like TAVI for aortic valve replacement, can restore proper blood flow. These procedures aim to correct structural or electrical problems that cannot be managed by medication alone. After a heart event or procedure, cardiac rehabilitation is a structured program involving supervised exercise, education on heart-healthy living, and counseling to reduce stress and help you return to a full, active life. It's a crucial step in recovery and long-term prevention. Finally, regular follow-ups. with your cardiologist and primary care physician are essential. These ongoing appointments allow your healthcare team to monitor your condition, adjust treatments as needed, and provide continuous support. Remember, medical solutions are part of a personalized plan. Your doctor will determine the best approach for you. We've covered a lot of ground today, from understanding common heart conditions to exploring various management strategies. Now, let's bring it all together by focusing on prevention strategies, the proactive steps you can take to safeguard your heart health for years to come. The core message here is that prevention is always better than cure, and it's never too late to start. A crucial component of prevention is early and regular screenings. Don't wait for symptoms to appear. Schedule routine checkups with your doctor. These appointments are vital for monitoring key indicators like blood pressure, cholesterol levels, and blood sugar. Your doctor may also recommend specific tests like an EKG or echocardiogram based on your individual risk factors and family history. Identifying risks early allows for intervention before conditions escalate, giving you the best chance to prevent serious heart problems. Next, adopt a truly holistic approach to health. This means integrating all the lifestyle factors we discussed: a heart-healthy diet, rich in whole foods, regular physical activity tailored to your capabilities, effective stress management techniques, avoiding smoking, and moderating alcohol intake. Think of these elements not as separate tasks, but as interconnected parts of a healthy lifestyle that collectively protect your heart. Prevention is a lifelong journey, and every small, consistent step contributes significantly. Remember that personalized care is paramount. While general guidelines are helpful, your unique health profile, genetic predispositions, and existing conditions mean your prevention plan should be tailored specifically for you by a healthcare provider. What works best for one person might need adjustments for another. Don't hesitate to ask questions and actively participate in creating your personalized health strategy. We want to emphasize empowerment through knowledge. By understanding the causes, symptoms, and prevention methods of heart disease, you become an informed advocate for your own health. This knowledge empowers you to make conscious choices, ask the right questions, and partner effectively with your medical team. Finally, remember the importance of community support. Surrounding yourself with family and friends who support your healthy choices, joining exercise groups, or participating in health education programs can provide motivation and accountability. Don't underestimate the power of a supportive environment in maintaining heart-healthy habits. In essence, preventing heart disease in older adults is about being proactive, informed, and consistent. It's about making conscious choices every day that contribute to a stronger, healthier heart. By embracing these prevention strategies, you're not just avoiding illness. You're investing in a future filled with vitality and well-being. As we conclude our comprehensive discussion on common heart diseases in older adults and their prevention, I want to leave you with a message of hope and empowerment. The journey to a healthy heart, especially as we age, is a continuous one, but it is deeply rewarding. We've learned that while certain risk factors like age and genetics are beyond our control, a vast array of lifestyle choices and medical advancements are firmly within our grasp. You now have a deeper understanding of conditions like CAD, heart failure, arrhythmias, and valvular disease, and recognize the subtle and sometimes atypical symptoms that can appear in later years. More importantly, you're equipped with practical, actionable strategies, from embracing a heart-healthy diet and staying physically active to managing stress and adhering to medical treatments. Remember, your heart is resilient, and it responds incredibly well to care and attention. Don't hesitate to partner with your healthcare team, ask questions, and be an active participant in your health journey. Every small step you take towards a healthier lifestyle contributes to a stronger, more vibrant you. Embrace this knowledge, make informed choices, and live your golden years to the fullest with a heart that beats with health and vitality. Thank you for joining us. And here's to a lifetime of heart health